Due to COVID-19, our CPR processes have had to change. To protect ourselves, we must don the appropriate PPE, we must also prepare the patient, and we must avoid manipulation of the airway at all costs. So what does this look like? Gone are the days of non-protected CPR, such as shown here in this quick video. When a patient is found unresponsive, the right thing to do is still call for help and activate your code blue response. However, there are some differences. We must ensure that we protect ourselves against COVID-19. First responders must ensure they're wearing enhanced droplet contact PPE. This includes a surgical mask, gloves, and some sort of hospital gown. Patients themselves must also be covered to protect us. Prior to chest compressions, oxygen must be placed via nasal cannula at 5 liters. A surgical mask is then placed over top of the patient's face and nasal cannula. A towel and a plastic sheet can then be placed over the patient's face as well. We must also retrieve an AED device. The sheet can be placed like this around the patient and tucked in on the edges to minimize any exposure of aerosolized particles. The patient should look something like this with a plastic sheet over top. Chest compressions and basic BLS can now be initiated while the code team from urgent care arrives with the crash cart. The most crucial part of all of this is that absolutely no airway manipulation or bag valve masking should take place. These procedures generate aerosolized particles, which present the greatest risk to healthcare workers and must be avoided at all costs. Compression-only CPR will continue with defibrillation until the code team arrives. If the resuscitation is deemed to be futile and the patient is not a resuscitation candidate, palliative measures will be put in place. If the resuscitation is in fact appropriate and is not futile, the team will subsequently don enhanced droplet PPE and preparations will be made for transport to urgent care. In summary, call for help early, protect yourself, and wear the appropriate PPE. Prepare the patient with the necessary plastic sheet, facial mask, and cannula. Initiate compression-only CPR. Absolutely no airway manipulation should take place, and BLS as above should continue until the urgent care code team arrives. Thank you for everything you do, and keep calm and carry on.